A warm welcome to my session. Today we are discussing about the importance of dietary fiber, how it become helpful for the daily life. So, let us see what is a fiber. It is a substance seen in plants which is a kind of carbohydrate we eat through the plant material. The dietary fiber, which is also known as rage or bulk, which includes the parts of the plant food your body can't digest and absorb. Instead, it passes relatively intact through your stomach, small intestine and colon and out of your body. And let us see good sources of dietary fiber where we get the whole grains, nuts and the seeds, the fruits and the vegetables, beans, peas and other all legumes we eat on our daily routine. The fibers can be divided into two types, the soluble fiber and insoluble fiber. As the name mentioned, the soluble fiber which dissolves in water and can be metabolized by the good bacteria in the gut, whereas the insoluble fiber which does not dissolve in water. Perhaps it is more helpful way to categorize the fiber is fermentable versus non-fermentable, which refers to whether the friendly gut bacteria can use it or not. It is important to keep mind that there is many different types of fibers. Some of them have important health benefits while others are mostly useless. There are a lot of overlap between the soluble fibers. Some soluble fibers can be digested by good bacteria in the intestine. Most of our food we consume in our daily routine, both soluble and insoluble fibers. And these gut bacteria are also known as gut flora. This is not a bad thing. In fact, it is mutually beneficial relationship with you and some of the bacteria that live in your digestive system. You provide food, shelter and safe habit for the bacteria. In turn, they take care of something that a human body cannot do on its own. On many different kinds of bacteria, some are crucial for various aspects of your health, including weight reduction, blood sugar control, immune function and even brain function itself. It is very much helpful. So, as I have mentioned, it is classified as soluble which is dissolved in water, whereas insoluble which does not dissolve. The soluble fiber, the type of fiber which dissolve in water to form a gel like material. So, it can help to lower the blood cholesterol and also it very much helpful for the glucose level or it control the blood glucose. The soluble fiber which is commonly seen in oats, peas, beans, apples, citrus fruits, carrots, then barley, psyllium, etc. Where we get the insoluble fiber. This is the type of fiber promotes the movement of material through the digestive system and increases the stool bulk. So, it can be beneficial to those who struggle with a constipation or irregular stools. A lot of disease, this is a symptom, the constipation. So, where we get it from the wheat flour, wheat bran, nuts, beans, various types of vegetables such as cauliflower, green beans, potatoes, all these are rich in the insoluble fibers. The amount of soluble and insoluble fiber varies in different plant foods to receive the greatest health benefits. Eat a wide variety of high fiber foods. And let us see how this fiber is related to various types of diseases. Fiber appears to reduce the risk of developing various lifestyle diseases like heart disease, diabetes, diverticular diseases, constipation, etc. Despite of these benefits, fiber probably has little or if any effect on the colon cancer risk. So, heart diseases, how it is related to fiber intake. High intake of dietary fiber has been linked to a low risk of heart disease in a number of large studies that followed people for many years. In Harvard University, they make a study around 40,000 male health professionals, researchers found in high total dietary fiber intake was linked to 40% lower risk of coronary heart diseases. The same result were obtained in the case of female also. High fiber intake has also been linked to lower the risk of the metabolic syndrome. This metabolic syndrome nowadays people are suffering a lot. The combination of factors increases the risk of developing heart diseases and diabetes. These factors include high blood pressure, high insulin levels, high triglycerides levels, and especially around the abdomen the deposition of fat is taking place. Most of the people are suffering from this pear shaped belly or apple like belly. This depends on the amount of fiber we take in our daily routine. Then how it is related to type 2 diabetes. Diets which is low in fiber and high in food that causes sudden increase in blood sugar may increase the risk of developing type 2 diabetes. Here also the Harvard studies of female nurse and of male health professionals found that the type of diet more than doubled the risk of the type 2 diabetes when compared to a diet high cereal fiber and low high glycemic index foods. A diet high in cereal was linked to lower the risk of type 2 diabetes. So, here we have to just mention that I mentioned here the intake of cereal fiber rich food included in the diet of diabetic especially type 2 diabetic patients. Then next important diseased condition due to lack of fiber is diverticular diseases. This diverticulitis, it is an inflammation of the intestine, is one of the most common age related disorder of the colon in western society. Now it is more common in our also. Among the male health professionals in a long term follow up study, eating dietary fiber particularly insoluble fiber was associated with about 40 to 50% lower risk of diverticular diseases. Then fiber and constipation, which is very common among old age people. Nowadays it is always common in youngsters also, because most of our diet are junk food or ready made food, or we depends on fast food consumption. Constipation is the more common gastrointestinal complaint in our society, which relieve and prevent, what we have to relieve and prevent this constipation. The fiber in wheat bran and oat bran is considered more effective than fiber from the fruits and vegetables in this case. Experts recommend increasing fiber intake gradually rather than suddenly, and because fiber absorbs water, because insoluble fiber absorb more water. Then beverage intake should be increased as fiber intake increases. Then colon cancer. Studies have largely failed to show a link between fiber and colon cancer. One of these studies in the Harvard University that followed over 80,000 female nurses for 16 years found that dietary fiber was not strongly associated with reduced risk of either colon cancer or polyps, the precursor to colon cancer. Then how it is related to breast cancer? Most of the females nowadays affecting in our society, or they are suffered with a breast cancer. A large scale 2016 study led by researchers at Harvard T.H. Chan School of Public Health, they showed that finding the higher fiber intake reduces breast cancer risk, suggesting that fiber intake during adolescence and early adulthood, it may be very particular important. Women who eat more high fiber diet during adolescence and young adulthood, including vegetables and fruits, may have significant lower breast cancer risk than those who eat less dietary fiber when during the younger stage. Then let us see what are the benefits of high fiber diet. As we have mentioned, it normalizes the bowel movement. Dietary fiber increases the weight and size of the stool and softens our stool. A bulky stool is easier to pass, decreasing your chance of constipation. If you have loose watery stools, fiber may help to solidify the stool because it absorbs water and adds the bulk to stool. Helps maintain bowel health. A high fiber diet may lower your risk of developing hemorrhoids and small pouches in the colon, that is diverticular diseases. In Malayalam, we are saying piles or fistula. Studies have also found that some fiber fermented by the colon. The researchers are looking at how this may play a role in preventing diseases of the colon. Then the next important function is it lowers the cholesterol level. Soluble fiber found in beans, oats, flaxseed and oats bran, which may help to lower the total blood cholesterol level by lowering low density lipoprotein or bad cholesterol level. And also high fiber food may have the heart health benefits such as reducing the blood pressure as well as inflammation in the whole body. And also the high fiber intake just control the blood sugar level also. In people with diabetes, the fiber, particularly the soluble fiber, can slow the absorption of sugar and help improve the blood sugar level. A healthy diet that includes insoluble fiber may also reduce the risk of developing type 2 diabetes. The recommended intake of fiber. According to the Academy of Nutrition and Dietetics and also World Health Organization, it is recommended to intake the dietary fiber in a 2000 calorie diet is around 25 grams per day in the adult females and 38 grams per day for the adult males. People need less fiber after 50 years of age at around 21 grams for women and 30 grams for the men. During pregnancy or breastfeeding, women should aim at least 28 grams per day. Then some of the tips for increasing the intake of fiber. Eat whole fruits instead of drinking fruit juices. We are always practicing fruit juices along with a lot of white sugar, but actually we are mixing with the sugar with the white poisons. To avoid fruit juices, so eat whole fruits as such. Replace the white rice, white bread and pasta with brown rice and whole grain products. For breakfast, choose cereals that have a whole grain as their first ingredient. The snacks on raw vegetable instead of chips, crackers and chocolate bars. Then substitute beans or legumes for meat 2 to 3 times per week in chill or soup. So, here we see how this simple fiber helpful for our daily life. Thank you.